In this video, we are going to see the performance of mechanical insufflation-exsufflation using a Clearway machine, a modified manual assisted cough, and closed suction via the trachea. These treatments are indicated in the patient as they are recovering from a chest infection post complications after surgery for deep brain stimulation. He has a background of spinal cord injury from an accident 20 years ago and therefore requires daily chest physio to help manage his secretions. The physiotherapists will set up the equipment prior to commencing the treatment with the patient. Firstly, the mechanical insufflation-exsufflation or MIE machine is set up. Here the machine has been set up on a trolley so that it can be close to the patient. The power cable and hand remote are attached to the back of the machine. The circuit is then attached to the front of the machine, with the filter being the patient end of the circuit and the wide opening being the machine end of the circuit. The wide opening is attached to the black outlet on the machine and the pressure line is attached to the white outlet. After the filter at the patient end of the circuit, if you are using the treatment with a self-ventilating patient who has their own patent airway, you would attach the face mask to ear or mouthpiece if that was the patient preference. When treating a patient with a tracheostomy, like with this patient, you would attach the closed circuit mount to the filter at the patient end of the circuit. When the circuit has been attached to the machine, it can be turned on using the on-off switch at the bottom left of the screen. Once you have turned the machine on, you will need to decide which mode to perform the treatment in. The options are manual, basic auto, timed auto, and triggered. Looking at the screen now, the machine has been turned on in manual mode, which is demonstrated by the green hand in the middle of the screen. If you want to change the mode, this can be done using the mode button on the bottom left side of the screen. Before you change the mode, you will need to check the machine is unlocked. Looking at the screen now, you can see the shape of a black padlock in the bottom right of the screen, which is in the unlocked position. If you need to unlock this machine, this can be done holding down the plus and minus buttons in the bottom right of the screen simultaneously for 5 seconds until the machine beeps and the padlock picture changes to an unlocked version. In manual mode, you will then look at the insufflation and exsufflation settings at the top of the screen on the left and right side accordingly. To adjust these settings, you will press the button and use the plus and minus numbers to go up and down. For this patient, we have used the settings of positive 40 for insufflation and negative 50 for exsufflation. For the automatic modes, additional settings are required. This includes the timing for the length of the insufflation and exsufflation and the pause between the treatment cycles. When you are ready to start in an automatic mode, you would then press the start-stop button and the machine would cycle automatically through the cycle that you have set. The potential contraindications and precautions are related to positive pressure and include an undrained pneumothorax, phragmoptosis, severe bronchospasm, raised intracranial pressure, recent esophageal or lung surgery, cardiovascular instability, surgical emphysema, recent facial fractures if you're using a face mask, and proximal tumours, although you may discuss with your consultants the risk-benefit for treatment. The suction will be prepared prior to treatment. The therapists have put on their PPE or personal protective equipment in preparation for this treatment, including protection for the eyes and mouth due to the potential risk from spray and secretions. Prior to attaching the closed suction mount to the MIE circuit, the physio will check the suction pressure to ensure that it is not higher than 20 kilopascals. We can see here in the video, the physiotherapist is checking the suction against the machine to see what the pressure is reading when suction is applied. Once you are happy with the suction pressure, the suction tubing can be attached to the end of the closed suction catheter ready for treatment. The physiotherapist will also unlock the suction on-off knob, which is attached to the closed suction mount prior to treatment so that suction will be ready to apply during the physiotherapy treatment. Lastly, the physiotherapist will make sure that the risk assessment has been completed in terms of the bed space and that the environment is safe for treatment. This will include making sure the bed height is appropriate to the physiotherapist performing the manual assisted cough. For this patient, the manually assisted cough is modified due to the positioning of a RIG, or radiologically inserted gastrostomy. Therefore, their positioning of the hands has been moved in preparation for this. There are a number of ways the manually assisted cough can be produced, including a forearm across the abdomen or 2 hands in the middle of the abdomen, with the aim of scooping up underneath the diaphragm as the patient attempts to cough. Additionally, the physiotherapist will also decide before starting the treatment what their roles are so that they can communicate with each other effectively during the session. They will also discuss the treatment plan with the patient so they know what to expect during the treatment session. The physiotherapist will also make sure that the patient is positioned correctly for treatment. In this case, patient preference is that he prefers to be treated in supine position because he feels this gives better bilateral clearance and maximises effectiveness for the modified manual cough in terms of where the physiotherapist can put their hands. As we are completing a positive pressure technique with the patient, here we can see that the physiotherapist is checking the cuff pressure prior to starting treatment. This is checked using a handheld manometer, where the manometer is placed in the port of the pilot balloon of the trachea and the pressure should be read between 25 to 34 centimetres of water. We will now see a treatment cycle being completed with the patient.
So that's on, okay. So, breath in and out. Breath in and out. Okay, and breath in, feeding down, and cough, and suction out, cough, 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 cough. Well done, really good. A couple of breaths at the end. Got any more, Alan? One more. Okay, we'll do one more cycle. So breath in and out. Breath in and out. Okay, and breath in, feeling down, and out, and cough, 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 cough. Well done. A couple of breaths at the end. Okay. Right, take that off. Okay.
During the treatment, we could see the physiotherapist attach the closed suction mount at the end of the MIE circuit to the trachea. The remote control was then used to deliver a 3-to-1 ratio of treatment, which consisted of 2 insufflations, each followed by a pause, and then a final insufflation, which went straight into an exsufflation. If you do not have the remote control attached to the MIE machine, there is also a knob at the front of the machine which allows it to cycle through insufflation, exsufflation. A modified manual cough was also performed on each breath. You may decide that you just want to do this on the last exsufflation breath, but with the patient we see here, he had requested them on each breath as part of his treatment. As you watch the treatment, you will see that the physios perform the manually assisted cough together with the exsufflation technique. Additionally, you can see that the second physio is passing down the suction catheter through the trachea so that the tip is placed in the carina by the time the exsufflation is applied, allowing the suction, exsufflation and manually assisted cough to be performed simultaneously. Following suction, 2 recovery breaths were performed by the therapist. The evidence would suggest that peak cough flow is significantly greater when combined between a maximum insufflation and manually assisted cough compared to when their techniques were studied alone. This was shown by Trebbier et al. 2005. Treatment would continue until the patient fatigues or secretions have been cleared. Following stopping treatment, you would re-evaluate the patient in terms of volume of secretions cleared, oxygen saturations, changes on reauscultation, and patient feedback about whether they feel clear. During treatment itself, you would monitor for any adverse events, and this would trigger you to stop the treatment immediately. Thank you for watching, and I hope you found this useful to watch.